The Chatty Dentist provides general advice and insights on patient communication in dentistry. However, we want to make it clear that we are not affiliated with any dental council or professional organization. The information shared in this podcast is for educational and informational purposes only. We want to emphasize that the content presented on the Chatty Dentist should not be considered as professional, specific, or personalized advice for individual cases. We do not make any guarantees or warranties regarding the accuracy, completeness, or applicability of the strategies discussed. It's important to note that the dental regulations, standards of practice, and professional guidelines may vary significantly by region. Therefore, listeners are strongly encouraged to consult with qualified professionals or relevant authorities in their respective areas for specific guidance tailored to their unique circumstances. By listening to the Chatty Dentist, you acknowledge and agree that the podcast hosts, guests, and producers bear no responsibility or liability for any actions taken or decisions made based on the information provided in the podcast. We disclaim all liability for any direct, indirect, incidental, consequential, or punitive damages arising out of your use or reliance on the podcast content. If you want to get in touch with us, please email us at ask@thechattydentist.com. We want to acknowledge the Burunong people of the Kulin Nation as the traditional custodians of the land we are speaking from. We want to recognize their continuing connection to land, waters, and culture and pay our respects to their elders, past, present, and emerging.
Miss Smith, a 30-year-old lawyer attending your clinic, complains of an ulcer on the lateral border of the tongue on the right side for the past 1 month. Her last dental visit was 2 years ago for a filling in the tooth 4-6. The filling fell off a few weeks ago, but it has not bothered her. You haven't done any examination yet. Address the patient's concerns, gather information, explain the necessary investigations, and give differential diagnosis.
The pointers here would be that we focus on the features of the ulcers with emphasis on the red flag lesions. We must focus on the underlying causes, and we should also conduct a thorough differential diagnosis. Let's start the role play now. Hello, Miss Smith. Welcome to our surgery. How are you feeling today?
I've been good. How about you?
That's good. Thank you. Thank you for asking. Please have a seat and let's just discuss about what brings you in today.
Sure.
Okay, so can you tell me a little bit about what's bothering you?
So I have something on my tongue which has been hurting me a little bit. It's not too uncomfortable, but yes, I think for a few weeks now it's been, I'm not really sure. I think probably something's hurting it, but I do feel like something's, bulging out a little now.
Oh, okay. When did you start noticing this first?
About 2-3 days ago.
Okay, and when that happened, did you notice any other symptoms associated with it, like a fever or swelling or any other issues?
For the past 3-4 days, I've not really had any fever or anything like that.
And how painful is it?
It depends on what I eat. If I eat something spicy or hard or hot, then yes, it does pain.
Okay.
And it's okay, it's just there.
Okay. Has this ever happened to you before? Have you noticed anything like this in the past?
No, this is my first time.
And have you ever noticed this happen anywhere else in the mouth? Any other ulcers that you've noticed?
No.
No, okay. And also, have you noticed any bleeding or any discharge from this ulcer?
No.
Do you experience any numbness with this ulcer?
Not really. I don't think so.
Okay. And do you recall having any injury or any broken teeth or anything, or have you had anything to eat which may have caused an injury around that area?
I did have a filling that came off a few weeks ago.
Okay.
But then that's it. Nothing hard or anything that I've eaten, or nobody's hit me there or anything.
Okay, so no history of injury there as well. What about the interference with eating, drinking, or your function as such? Is that affecting any of these activities?
Just that I can't have hot food or spicy food because it starts to burn a little.
Okay.
Other than that, I'm quite okay.
Okay. What about your past dental history? Have you seen a dentist in the recent past for any treatments, any other concerns?
I think about 2 years ago I had a filling done.
Okay.
But after that, no, I haven't visited
No
a
issues.
dentist.
All right. What about medically? Are you fit and well? Do you take any medications for any problems, any allergies?
No, I'm good. I'm quite fit and I don't take any medications on daily basis, and I don't really know if I have any allergies.
Okay. And do you have any stress at the moment? Are you undergoing any stressful situations?
Stress is there, it's an inevitable part of our
Yeah.
daily lives.
Yeah.
So I would not say I'm not stressed.
Okay.
I am definitely
understand.
stressed somewhere.
Yeah, absolutely. And we know we should discuss about this as well towards the end of the appointment. I'm more than happy to offer
Okay.
you some resources. And can you also just tell me if you smoke or drink alcohol?
I used to in my young age, but I'm trying not to these days. I
Okay.
have stopped smoking about a year ago, but sometimes alcohol is welcome.
Okay, yeah, that's good. But do you have anyone else in the family who has suffered from any such ulcers or anything in the past?
I think my sister had these stress ulcers that you call them around her lips sometimes
Okay.
during exams, but that's only in childhood because we have our own houses now.
Yes.
I don't know what's happening.
Okay.
So
Yeah.
that's the only thing that flashed up my mind. I
All
can't
right.
think of anything
Fair
else.
enough. Yeah, absolutely. All right. Thank you so much for answering all those questions. I know that I've been asking you a lot of questions throughout, but it's just a good thing for us to just take a thorough history of what's been
Yeah.
happening and, just try and pinpoint some likely
Mhm.
causes for it.
Mhm.
To me, it sounds like this could be either from trauma, from injury. Like you said, that the fillings come off a little while ago. It could be that, there's probably a sharp corner there around the tooth there. So
Okay.
maybe that's likely causing this ulcer sort of appearance here.
Mhm.
I'll definitely have a look around that tooth to see if there's anything that needs to be done. Otherwise, it could be stress ulcers, which we call them as aphthous ulcers. And that's why I was asking you if you have anyone else in the family who possibly suffers from this. Now, I know you said you're medically fit and well, you don't take any medications and any of those things, but it could be sometimes that if there is a condition that's gone unnoticed and, is something that has not been detected, that also can lead to ulcers in the mouth. So nutritional deficiencies like iron and things like that can also lead to it. So that's the reason why it's a good idea for you to just check back with your doctor.
Okay.
And just make sure that we're not missing out anything there.
Okay.
That's something that I would definitely recommend once you head back out
Okay.
of the appointment today. Sometimes some infections could also lead to it, and that's the reason why I was asking if you were well within the last few days, if you've had
I've
any
been
issues.
fine. Okay.
Yeah. So these are some reasons. Is that all clear so far, Ms. Smith?
Yes. So what are we gonna do about it? Can you provide me some relief?
Yeah, absolutely. So before we do that, I'll just go ahead and do some further investigations just for us to see if there are any other things that we could find out.
Okay.
So first, what I'll do is I'll just check around your mouth, around your jaws, just to check for any lumps and bumps. Get a feel around there, and then we'll just look inside. I'll check all the teeth first. I'll just go over with my instrument to just check your gums and just make sure everything else is okay. We will need to do a couple of x-rays as just a part of routine exam as well to make sure that we're not missing anything underneath the teeth or the jaw around there. And yeah, obviously I'm going to have a look at the filling to see if what's happening there. It's very likely that we should repair it and put another filling there
Yes.
rather than leaving the tooth.
Oh yes.
like
Yeah,
that.
you can definitely do the filling if you
Yeah.
can today.
Definitely. So we'll have a look at that as well.
Okay.
Management wise, the first thing we should be doing is eliminate all the triggers. So if I find that today during my exam, if I find that indeed that tooth which has lost the filling is sharp, and I can see that if your tongue is actually rubbing against it and leading to this sort of an ulcer,
Okay.
then of course that would be a trigger. So we do need to make sure that that's taken care of. But if I don't find that to be the issue, then like we discussed, we'll go ahead with the other investigations, and I will definitely wait to hear back from you with regards to your medical appointment as well.
Okay.
And like we discussed earlier, stress management is something that I'm more than happy to help you out with. And once that's all taken care of and we have a cause that's identified, it's much easier for us to go ahead from there. I can provide you with a numbing gel as well today that
Okay.
will help you ease the pain a little bit when you're eating and drinking. And I know that this is not an easy conversation, but talking about quitting smoking is also quite important. And
It's been a year since I quit. Like I told
that's
you,
great.
yeah.
That's fantastic.
But yeah, I definitely do have the urge to go back.
Yeah.
I am fighting it quite hard.
Okay. Yeah. That's good. So it sounds like you've got a lot of things under control already. So we definitely have to look into all these things. I do have to let you know that after doing all of this as well, and if in my next review, and if it has crossed 2 weeks, and if this has still not healed, then I do definitely need to send you to see a specialist,
Okay.
because we then have a suspicion that this could be an underlying condition which is leading to this non-healing ulcer. So we need to make sure that we take care of that as well.
Okay. Yeah, I hope it's not something serious, and I hope you get to know the cause and we can treat it right.
Yes, absolutely. Yes.
Yes.
So do we go ahead and do the investigation?
Yes, sure.
Oh, good then.